World AIDS Day, and the estimated overall HIV prevalence rate is approximately 13.1% among the South African population. The total number of people living with HIV is estimated at approximately 7.52 million in 2018. The national commemoration event will be held at Dobsonville, Soweto in Gauteng. We look at the progress made in terms of fighting HIV and AIDS and perhaps the challenges that are still, remaining. We have Steve Letsike in studio. She, of course, is the Deputy Chairperson of the South African National AIDS Council. Good afternoon to you. Thank you so much for coming through.
Good afternoon. Thank you so much for the invite.
Now, this year marks, the 30th commemoration of World AIDS Day, and the theme is Cheka Impilo, meaning know your status. Just before we dwell deep into the theme, how are we looking in general terms?
I mean, as you have said, that we have over 7.5 million people living with HIV. And I think the good thing is that South Africa has the biggest ARV treatment program, in the world, with over 4.1 million people on treatment. However, I think the President in his State of Nation address said we need to put 2 more million on treatment. When people take their treatment, we suppress what we call the viral load. When the viral load is suppressed, fully suppressed, it will become undetectable, and it's very important that we encourage people, to test, check Impilo, so that we do so. The biggest worry that we have is the prevention agenda. Our new infections are still high.
I was going to come to that to say that we do know that, of course, strides have been made in terms of fighting HIV and AIDS, but new infections, I think last year this time, we were looking at 270,000 new infections per year. So you were telling me that the number went down a little.
Yes, our Human Science Research Council study that was released earlier in the year, in fact mid this year, had indicated that we are just below 239,000 per annum. One of the biggest challenges that we have, it's infections amongst young girls between 15 years to 24 years. What we know is that these girls are not infecting themselves. Men are the culprits in this case. 15 to 24 years are still young women, adolescent girls and young women. We have just over 1,800 new infections per week amongst those girls.
And that's between the 15 to 24
just
years.
Between 15 to 24 years. And then we've got other population like...
But let's just dwell a little bit on this one. What's the problem? Why are we still sitting with, such a huge number?
We are sitting with that huge number because one is that these girls are not infected by boys their age, so which means macho or mobile men with money. These are older men that infect, and we have got issues of, I never liked the use of sugar daddies.
Sugar daddies and blessers.
Blessers, or however they define older men with money. And it could easily be just a taxi driver, a politician, and so forth. These men are the ones that are targeting young girls, and that's a big problem. We're sitting with the issue of social issues, poverty, unemployment, that is cropping our families and our communities, and that's why young girls are vulnerable. So there's an issue of social and structural barriers in this case.
But what needs to be done going forward? How do we deal with this issue? Because I would want to imagine, Steve, that in this day and age, everyone knows of HIV and AIDS, and they know how one gets it and what to do not to get it. So what needs to be done?
There are a couple of things. The behavior of individuals is very crucial. I mean, what we know, Check Impilo also is prioritizing men must go to check their status. A lot of men don't go and check their status. A lot of men don't even know they have HIV. And we want to encourage South African men to go and test. That's the first step that we want to do as a behavioral issue.
I remember there was a program. Was it voluntary testing and counseling?
Of course.
How did it work? Did it achieve its objectives?
It has over time. I mean, we've launched the HCT campaign in 2010, and this on its own, we've seen during that year, we've tested over 20 million South Africans. But over the years, the numbers dropped because when you test, you want to encourage people to come back, test annually at least, but there are window periods in terms of testing. But also what we encourage is that when you come to test, you would know your status so that if you are negative, you will remain negative. And remaining negative, that means you must use a condom, you must do quite a lot of preventative methods to it. And right now we've got pre-exposure prophylaxis, so that also when you are not using a condom, you have other options. So if you don't want to also now go, South Africa, we've launched what we call the self-testing kits. Those are available to look at options so that we know our health.
And I suppose that speaks to the theme for this year check-in bill.
Of course.
Yeah. So a very worrying UNICEF report I read this morning, which indicates that AIDS kills 76 adolescents around the world every day, and some 360,000 will die by 2030 unless something is done. Something
must be done. We must address the social determinants. If we don't address gender-based violence, here we are in 16 days of activism. Gender-based violence is a driver of the epidemic as well. What happened to the laws where we know that age of concern is 16? Any child that is having sex with an adult whatsoever, it's still regarded as statutory rape. You know, the consent issue still needs to be interrogated. But we also know youth going to clinics and facilities is a big challenge. Health professionals are still rejecting some of them. Health professionals are still discriminating. Why are you having sex and so forth? For those who are sexually active, we must ensure they do it safer.
All right, so let's talk about tomorrow quickly. The main event, of course, at Dobsonville in Soweto.
I mean, we are commemorating, of course, the International World AIDS Day, and it's also happening at a time where we commemorated Nelson Mandela, Albertina Sisulu, and here we're coming back to saying, South Africans, let's commit. Whether you are in government, you're in private sector, you're in civil society, let's commit. But we are also calling, you know, civil society is part of this voice, communities are part of this. The investment of billions that goes into HIV must go into communities where the communities respond. We can't have a very large gap in terms of what money comes in and how it's coming in terms of implementation. So we will be in Dobsonville. There are various activities. The Deputy President will be there as the chair of the South African National AIDS Council, ministers, representative of civil society, and particularly youth. Will be there because that's our focus area as the council.
It is indeed. We've just had an interview with one of the ambassadors for Me First campaign, which speaks to men who are having sex with other men and the HIV prevalence, of course, amongst them. I quickly want to touch on the issue of HIV and AIDS and the LGBTI community. We do know that luckily South Africa is one of the very few countries around the world which has included the needs of these community members, of course, in its national response to HIV. Talk to us a little bit about that.
Look, I think the good thing is that South Africa has launched the LGBTI HIV plan, which is then saying that we must target LGBTI community, men who have sex with men, but also we must target transgender women, because transgender women are 49 times higher of contracting HIV than any adult of any reproductive age. So the importance of targeted intervention. There's a lot of stigma and discrimination that's still going on. So what we're trying to do is then, how do we then say to the LGBTI community, it's okay, come out in your numbers, know your status, be involved, be part of LGBT organizations that are doing fantastic. Triangle in Cape Town, out in Pretoria, Devon Center, She in Eastern Cape, many LGBT organizations who have been doing work to say, know your status, let's look at our behaviors, but also let's contribute to the agenda of response.
Yeah, you know, we could talk the whole day about these issues, but I'm afraid we have to leave it at that. Thank you so much for coming through.
Thank you.
All right. Many thanks there to Steve Letsike, Deputy Chairperson of the South African National AIDS Council, reflecting a little on the state of affairs in terms of HIV and AIDS here in South Africa, and it certainly shows that there's still a long way to go, more so in terms of new infections. We're looking at, 239,000 new infections every year here in South Africa on girls between the ages of 15 and 24. And as Steve said, something has to be done. Peter?